Welcome back to Western New York Living. If you're a female watching the show right now and commonly suffer from pelvic pain, aching, or maybe pelvic bloating and fullness and believe these symptoms are normal, you're more than likely wrong. I recently visited Windsong Radiology Group to find out more about pelvic congestion syndrome and a very easy procedure that can alleviate these symptoms. Imagine being an active woman living life knowing physically something's wrong, but not being able to find out the answers to your medical problems. That's exactly what Mariah, Kelly, and Marion experienced before they found out they suffer from pelvic congestion syndrome. Their symptoms may be familiar to many females watching right now.
The symptoms I had at that time were a constant dull ache in my pelvis, just kind of a heaviness, even I would describe it as throbbing at times. By the end of the day, the pain would always be worse after I've been on my feet. Sometimes some bloating as well. And I didn't experience this so much, but I've heard other women even have physically looking small and flat stomach in the morning and swollen by the end of the day.
Pelvic congestion syndrome can affect anyone, but for many women, it is underdiagnosed as a cause of chronic pelvic pain.
Pelvic congestion is similar to varicose veins in the pelvis, and it's pretty evident in men, but in women, the veins are in the pelvis and you can't see them. So it tends to go undiagnosed for quite a bit of time just because those varicose veins are in the pelvis. So people are most prone in the 20 to 40-year-old range, and oftentimes they've had multiple pregnancies, just because pregnancy will worsen the condition. Other things that can contribute to it is a family history of varicose veins, either in the legs or the pelvis. And other things are a little bit more subtle in terms of what your occupation is. If you do a lot of standing, that will predispose to it as well.
Dr. Dunleavy is one of the only doctors in the area that treats pelvic congestion syndrome. For patients like Kelly, it was a relief to know her symptoms could be treated.
To actually come in and be told, okay, this is what's going on, you have pelvic congestion syndrome, there's an answer, I actually felt a sense of relief because I could go home and tell my husband that I'm not going crazy, but hearing those answers and getting what I needed to hear at that point really made me feel like, okay, there's a path, there's something that can be done, there's answers, there's hope.
Pelvic congestion syndrome is an outpatient, minimally invasive procedure that takes very little time and has a success rate of close to 95%. As I found out from Dr. Dunleavy, the procedure is very similar to a varicose vein treatment.
Because it's in the pelvis, you have to use different equipment to close down the vein, but that's exactly right. Whether it's an incompetent, meaning refluxing vein in the leg, or a refluxing vein in the pelvis, you're trying to shut down that vein that's causing these problems so that it uses the normal veins. So it's nearly painless. Essentially, the discomfort would be related to putting a catheter into the vein, and we numb the skin and offer IV sedation for that. And we have all of the same equipment that we have in a hospital setting, to do the image-guided procedure, and people go home right after. But in terms of really feeling significant improvement, it takes about a month to notice the improvement, and then we'll continue to improve over the first 6 months.
For Marion, the relief of knowing her chronic pelvic pain could be treated by a minimally invasive procedure at Windsong Radiology Group changed her entire way of living.
I see people name the symptoms that I have, and I'm just like, you got to go to Windsong. You got to see Dr. Dunleavy. To me, it was just amazing. I had to give him a hug because I can't believe he fixed it. I felt so relieved.
To find out more about pelvic congestion syndrome and the minimally invasive procedure that they're performing at Windsong Radiology Group to alleviate this medical problem, just head over to Windsong's website. Their main campus located at 55 Spindrift Drive in Williamsville. It's Windsong Radiology Group, where patients come first.